Hi, I'm Dr. Joe Wierzbicki, and I'm a sports medicine specialist. And today I want to tell you a little bit about how to use a walking boot properly. So this is a tall walking boot. The reason why you want to be in a tall walking boot for the majority of foot and ankle injuries is because this is going to stabilize you at the top end and the bottom end. So that way your foot is not going to roll side to side. You're not going to put pressures through like this. And we're also trying to make sure that your ankle isn't going forward and down, something called flexion and extension. And so it needs to be tight in order to limit all of those motions. Okay. So here's that boot. Now, when you take off this initial piece, and some boots have this and others don't, the first thing is the fabric. You want to make sure that the fabric is covering the edges of these hard surfaces, and especially back here. Sometimes this fabric can be moving down and will not cover that. So you want to make sure that it sits like that. And the majority of these boots, they all have a Velcro that's attaching it to this hard shell. And so you can un-Velcro it and move it around. Underneath here is a small air bladder. So if you're ever having a malfunction of the valve, you can take this off and investigate that. Now the next piece. This is Florida. You do want to use a sock with this because you're going to be using the boot for a while and it's going to be getting sweaty. I'd recommend any sock. But specifically, if you're having an ankle injury, you may want to have a taller compression sock to also help you get rid of some swelling. And again, that's also extra padding around this hard, rigid surface. Now, as we buckle it up, you want these pads to be nice and snug. If there's a gap, if it's folding over on itself, it's going to create a pressure point. Now, what people commonly do wrong is, one, that they don't put their heel into the back like they should. Your heel should be all the way back in the back part of the boot, all the way back, feeling that back edge. The next thing that people do improperly is that they don't tighten these straps enough. This is the most common reason why people don't get better in the walking boot. Now this middle strap right here, this is the least important strap. So I like to start with that one. This one right here, we just want to have it nice and snug. And what a lot of people do also is they try and thread this through both sides, but that's just going to make it very difficult to put on and off. You don't need that. So either through this outer ring or the inner ring is fine. Sometimes if you have a smaller foot too, this tag will be hanging off and you can easily cut that so that it's not getting dirty. The most important part of this boot is this top strap. When it goes through, you should be pulling this as tight as possible. And then you latch it there. So often people come in and when they're walking with the boot, their cap is going forward and backwards, and that's not properly immobilizing the ankle. It needs to be tight. And then when you're walking, you won't feel that wiggle anymore. Now, if you're in a walking boot like this, it is preset plastic at 90 degrees, great. There's a lot of them out there that have this long hinge or long metal piece on one side and on the bottom side, and it allows you to move the fabric and how much of an angle your ankle is in. So this is 90 degrees, and you want to make sure that your alternate boot, that you're set up at 90 degrees. So feel free to move that fabric around. Also, the boots, they're interchangeable. You can use this for right or left side. On most boots, they're going to have an air compartment. This says compartment 1, and then compartment 2 is going to be on the other side. Once everything is nice and snug, and really this one should be nice and snug too, but again, this is the most important strap. This is for side 1, and you want to give this, there's the pump, this is your pump, and eventually you'll start to feel that bladder fill up and push up against the ankle. You don't want it to be hard, just a little bit of pressure there. And then you switch to the other side, side 2, and you inflate there. You're only inflating to the point where you start to feel a well-rounded pressure. And then when you're done, you're going to put it in the lock position. That way, if you're moving around and you lean this up against something, it's not going to accidentally deflate it. What's important with the boot also is that before you take it off, you deflate each side. If you don't, you're going to run into problems. So side 2, deflate. Side 1, hold it till it deflates. Now when you take off the boot, okay, it's easiest if you just Velcro these things back on the side. But I want to show you what happens, and this is the most common problem that people run into when they say that the boot is no longer fitting. These air bladders, if you don't properly deflate them, it's going to lead to a problem where it's going to fill up the bladder from the back, and then you won't be able to get your ankle, your heel, into the very back part. You'll know that this is you because your toes are going to start to hang off towards the edge because your ankle, your calcaneus, your heel isn't flat up against the edge. Okay. If you're not deflating the boot, after time and time again, what's going to happen is that residual air is going to build in the boot and make it not fit properly. So then when you look down at the boot, you see these two cushions that are full. And then when you try and put that boot back on, what's going to happen is that you can't get your ankle flush up against that back hard piece. And then your toes are going to hang off the edge. When I see people follow up and I see their toes hanging off the edge, I know that they're not deflating the bladder properly and that your brace isn't working properly. If this happens, occasionally you may need to push down just with your hand up against that bladder and deflate it. And then switch to the other side and do the same thing. Then when you try again, you're going to notice that your boot is feeling much different, much better. Okay. When you walk with the boot, again, you don't want to be forcing your foot forward because then you're going to notice a lot more forward and backward motion of your calf, and that's not what we want. Okay. If you're looking straight down at your feet, both your feet are facing forward in the 12 o'clock position, I like to recommend tilting this leg out a little bit, like about the 11 o'clock position. That way you're not going to force it as much and you're using it more like a peg. Okay. Have a slight bend in your knee because if your leg is straight, it's going to contribute more to this leg length discrepancy. So you want a slight bend in your knee, a slight hinge, cushion, and then you're going to come forward. Slightly tilt it out. Don't force it forward and backwards.